Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Here's your host, Cyrus Webb.
Welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again. But for our radio audience here in Mississippi at WYAD 94.1 FM and WYADonline.com, we're glad that you all could be with us. Also, tuning in to our friends at iHeartRadio and Amazon Music Podcast. We're glad you all could be with us as well. This is part of our News You Can Use segment here at WYAD. And today, we're talking to the guys out there as well as those who love our male audience. And we're talking about something that a lot of men are dealing with, especially those that may be over the age of 60, and that is enlarged prostate. You probably have seen commercials on television, heard about this condition. We're excited to welcome to our program today Dr. Rahul Mehan. He's going to talk to us not only about exactly what an enlarged prostate is, but also about treatment options that are available that can be of service and where you guys can go for more information as well. Dr. Mehan, thank you so much for the time. Really appreciate it.
Oh, my pleasure. Thank you for having me.
Well, this is an important topic, not always an easy one to be able to have, as you know more than probably I do, Dr. Mehan, for sure. So, as I mentioned, we hear these commercials talking about enlarged prostate. What exactly is that?
Well, the prostate is a small gland located right below the neck of the bladder and is part of the male reproductive system. The urethra, which carries urine from the bladder outside the body, runs right through the middle of the prostate. And a healthy prostate gland is approximately the size and shape of a walnut. But as men age, that prostate grows. And when guys get into their 60s and 70s, it can be the size of a lemon. And this is a very common process. It's not cancer. It's benign prostatic hyperplasia, or an enlarged prostate. And this causes the prostate to press against the urethra, causing chronic and sometimes troublesome lower urinary tract symptoms that can severely affect the quality of life of men.
So for our audience out there that may be wondering if an enlarged prostate is something that they're dealing with, Dr. Mehan, what are the most common symptoms of this?
Yeah, it's usually a gradual change. So I got guys in their 50s that come in there and they're like, well, I just wasn't peeing like I was when I was younger. They may be waking up at night to urinate, have a weak or interrupted urinary stream, having a hard time starting and stopping, feeling a sudden urge to urinate, not being sure that their bladder is empty, and dribbling at the end of urination. And it can get so severe that they have the inability to go when they feel like they need to go, or the lack of control over urination. And it's something that you can see that's gradual in the beginning, and later on in life, you go to the movies, and you're in the urinal, and you see an old guy there, and he's taking his time. That's because of an enlarged prostate.
Wow. And this is all, I think, very important information, Dr. Mehan, whether we're dealing with it ourselves or we have loved ones that may be dealing with this as well. And so it's something great for our audience to be aware of. So then, as you mentioned, it's not cancer. So what are some of the available treatment options then for an enlarged prostate?
Yeah, there are several treatment options for an enlarged prostate, depending on the amount of discomfort you're in, your age, health, the size of your prostate, and your post-procedural expectations. And in some cases, behavioral modifications is what guys start with. They may limit how much caffeine they drink or not drink a lot before they go to bed. There are medications, and there's medications that have been around for years. And medications may work, but they may not work for everyone. It requires consistent, lifelong use and can have undesirable side effects, including sexual dysfunction and dizziness. And we've had traditional surgical options, and those treatments work as well. But again, they have side effects, and those side effects can include difficulty emptying the bladder, urinary leakage, and sexual dysfunction. For patients who prefer to avoid surgery or who medications have proved insufficient or they don't want to risk those side effects, we have this new class of treatment called minimally invasive surgeries, and they're done in the office. And I'm here today with Boston Scientific, collaborating with them, talking about Resume, which is one of those treatment options.
So I'm glad you brought that up. So for our audience out there, of course, you probably had them hooked when you said non-surgical, Dr. Mehan, because I think those are options we all like. So what can you tell us about Resume, the water vapor therapy?
Well, this is technology that came out in 2015. It's been out for a while. We have data on it now that have spanned years, and what it is, it's a in-office, minimally invasive procedure to treat an enlarged prostate, not just the symptoms. I deploy steam or water vapor, and that energy is able to remove excess prostate tissue and shrink the prostate over time to help men urinate better.
Wow. And so I have to ask you, because as someone who is able to see, how this has been able to help patients, what has that experience been like for you to see how they've not only appreciated the option, but also the benefits of it?
Oh, this is a complete game changer. Did you know only 2% of men who have severe urinary symptoms, the worst of the worst, get treated? Because 98% of guys are too scared. They don't want to go under a surgery, or the medications may not work, and they just live like that. And what I've seen in my practice is now that we have new technology, it really opens the door. People are more comfortable coming into a urologist to be seen and to be evaluated, knowing that there are newer options. This is not like your father's BPH treatment. So this is not what's going to happen to, his course is very different to what we have now. And it's really opened the doors. It's been amazing to see.
Well, Dr. Mehan, we're glad that you could be here to talk to us about this treatment option for those who are dealing with enlarged prostate. Again, or you're talking about Resume water vapor therapy. Where can our audience go for more information?
Oh, you got to check out their website, resume.com, REZUM. And it's fabulous. I've been looking at this website for years, and it has a great introduction and some videos on what Resume is. They'll have a link to how you can find a doctor who offers Resume in your area. But it has a quiz. And this is what I encourage all you to do today, is to get on there and to take the quiz, and even for yourself or for someone you love, to really quantify your symptoms and see how bad the problem really is. And that could be your call to action to seek help and to get the treatment that is needed.
All right. Well, Dr. Mehan, thank you so much again for the time and the great information, and looking forward to having you back on the program again.
Oh, I would love that. Thank you for having me. We need to have these prostate conversations much more often.
I totally agree, and we appreciate you making it easier for us, for sure. And we thank your audience for tuning in to another great segment of Conversations Live, part of our News You Can Use segment here at WYAD. Until next time, I'm your host, Cyrus Webb, saying, as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live, and let's go make today amazing. Take care.